Welcome. Today's class is class number 4. And in today's class, we begin to look at some of the mental health problems that children in care sometimes display. In addition, we also begin to talk about a particular subpopulation of youth that we address and deal with in care, referred to as commercially sexually exploited children, or CSEC kids. Thank you very much. All right, so how's everybody doing? Got a couple of new faces in here, so Happy New Year to you as well. All right, is everybody good? All right, so today's class, class number 4, and in class number 4, we actually begin to look at a couple of different aspects of foster care, okay? So first thing that we're gonna start to look at is we're gonna start to look at some of the mental health issues or mental health problems that kids in foster care have. Okay, because it's important for me that a resource parent understands, one, that not every child that's placed in your home or young adult that could be placed in your home will have mental health issues. However, what's important is that if a child does have certain concerns or behaviors that are problematic, that you at least have a little bit of insight into, you know what, something's not right, and what do I need to do? So we begin to talk broadly about some of the mental health issues that kids have. The second thing that we're going to accomplish today is we're going to talk about a specialty population of youth, and that youth or that specialty population is referred to as commercially sexually exploited children, or what are referred to as CSEC children. Okay, and those are kids who are, for lack of a better word, taken advantage of and can be prostituted out or pimped out and things like that. And so we'll get into, after our break, we'll get into talking about our CSEC populations, because that is an ever-growing population of youth that need loving families, but who need families that are very supportive and understanding of some of their needs, okay? Because not everybody can deal with children who come from these backgrounds. So we provide information and insight into working with our CSEC populations so that you have a better understanding of that subpopulation of youth that we will deal with, okay? But before I begin, is there any questions that anybody has? Okay. Now, with that being said, you guys would have got a large packet of paperwork, and yours is black and white. Mine's a nice colored orange color. But I'm going to start by talking about the PowerPoint presentation that refers to infant, childhood, and adolescent disorders. Okay? And that's what we're going to start with. Now, I want to make something perfectly clear to everybody. Okay? I am not an expert, and neither are all of us. But my job is to make sure that we have a little bit of understanding, because one thing that I want to reiterate, and especially for those that have been to my classes before, you are part of a team, okay? When you are taking care of children in foster care, you are not on an island, solely you and the child. You are part of a team, and that team incorporates social workers such as myself. That team also incorporates the child's biological family. That team also incorporates Child Protective Services, county social workers, therapists, and other individuals that child is working with. So you are never alone. What is my goal today in pointing out information to you? One, education. Okay. Now, those that have heard me before, you'll hear me say it again. Those that are new, you'll hear me constantly say this. The materials that I give you today are good bathroom reading materials. Okay. Study them. Because the important thing about being a resource parent, or what we used to call a foster parent, is not being an expert in things, but being understanding of things. Experts don't like to learn new things because they already see themselves as experts. Being understanding and aware means that you are in tune and then allowing yourself to learn new things. So I'm going to go through and I'm going to talk about a lot of different disorders, but I'm going to focus in on some specific ones that are more common with the youth that we interact with and interface with, okay? So does everybody understand? We all good to go? All right, so let's look at some of the infant, childhood, and adolescent disorders. And I want to first talk about mental retardation, okay? As a resource parent, you are going to deal with children, and for those that are interested, you will also be dealing with young adults. Foster care is now designed to where we do not just take care of children 0 to 17 years of age. Foster care is designed to take care of children from the age of infants, 0, up to 21 years of age. Unfortunately, some of the kids that we deal with happen to have some problems that some other kids may not have. And so as a result, we do see where some of our kids that come into care happen to sometimes be a little bit slower than other kids. Now, in particular, when we talk about the issue of mental retardation, there's actually levels of mental retardation, okay? So you'll see where it talks about mild, moderate, severe, and profound. Mental retardation is based on the child's intelligence quotient, or IQ, okay? So here's what's important for you to understand. Yes, if you have a child in your home and that child is showing certain delays, or that child is showing certain behaviors that are concerning, maybe for whatever, let's say we have a 10-year-old and that 10-year-old's behaviors are not typical of a normal 10-year-old, the key is not to sit on that information. Okay? The key is to make your agency social worker aware of those particular concerns. You, as a resource parent associated with a coming of age, you are going to be documenting a lot with regards to what you see going on with your kids. Because as a social worker, one of the things that's important for me to understand is to have your insights. And so I'm not looking for you to tell me, oh, this child's IQ is 59, or this child's IQ might be this. What I want to know is, what is it that you see going on in the daily lives of that child that you're dealing with? And so if we look at this, we'll see that a child who has an IQ between 55 and 70, that child is identified as mentally retarded, but they are mild mentally retarded. Mental retardation, that determination is based on an IQ of being 70 or below. When a child has an IQ that has been identified as 70 or below, they technically meet the qualification or the identification of being mentally retarded. And then it's a question of, to what extent is their mental retardation? What's the level? Is it mild? Is it severe? Is it profound? Is it moderate? So that's where you'll see all of these different types of scores for mental retardation between 35 to 55, or 35 to 40 to 55, that's moderate. Between 20 to 40 is severe, and under 20 is profound. What do we typically deal with? We typically deal with kids who do have problems. Specifically, do we have children in our agency that currently are IQ of 70 or below? The answer is no. However, by the time some of you get approved, will we start to see populations of children that are placed in our agency that have a diagnosis of mental retardation? The answer is more than likely yes. Okay? Now, if you have a child in your home and that child, let's say, happens to be a little bit slow, what would be some of the things that you guys would kind of pick up on that child is slow? Let's say it's a 10-year-old, okay? And we had a child in our home who started to show concerning behaviors because it just didn't appear that they were, on track. What would be some of the things that would concern you? Okay, 8 years of age, not knowing how to dress themselves. Okay, that would be a red flag. What else?
Following simple instructions.
Following simple instructions, not being able to follow or comprehend simple instructions. Okay, what else?
Poor communication skills.
Okay, problems in school, poor communication skills, acting out, the child may not being able to verbally explain themselves as well. That child struggling in terms of their current academic levels. These are the things that are important for me as a social worker. What I do not personally am not worried about is you telling me that they are profoundly mentally retarded or that they are mildly mentally retarded. What is important for me is that you were taking care of the child, and if you begin to notice some concerns, I want to know what your concerns are in layman's terms. Tell me what you see. Don't have to impress me by trying to sound like a therapist. Tell me what you see as a parent. Tell me what your concerns are about the child that you are taking care of. So, mental retardation is a problem that we have experienced. Not in large part, but unfortunately, it is a problem that we are starting to see much more. Okay? Having said that, learning disorders. Learning disorders tend to be distinguished by below average cognitive or academic functioning, okay, when compared to a person's intellectual capacity. At the same time, one of the things about learning disorders, where are we going to really see learning problems with learning at? School, grade school, communication with you, okay? Learning disorders are something that we see a lot, okay? And it's important for you as a resource parent to not only be active in how the child is learning, but to also be active in regards to knowing that school, that child, if they're in school, knowing your level of involvement. Okay? How many of us right now are parents? Okay? How many of us love our kids? Raise your hands, people. All right? Okay, we all, oh wow. Okay, I gotta make a Child Protective Services call right here. So the reality is we love our kids. If our kids are having problems in school, failing grades, how many of us get in touch with that teacher or that counselor? How many of us are advocates for our child in terms of making sure that the schools are doing something, not just passing them along, because that's a big problem that we see. We'll see a child be passed along grade to grade to grade, and yet by the time they are now a senior, suddenly they're told, well, you can't graduate. But they've been passed along all the time. I'm a big advocate of, hey, if a child needs to be held behind, let's hold them behind when they're younger than just passing them along and then suddenly not letting them graduate now that they're old enough. I need resource families that understand and recognize that, hey, when this child is having problems, they're not waiting for somebody else or the school to say there's a problem. They're making the school aware, hey, what are we gonna do to fix this problem? So here's something that I want everybody to write down, okay? Has anybody ever heard of the term IEP? Okay, so I want you to write down IEP, Individual Education Plan. Second term, has anybody ever heard of the term SST? Okay, Student Success Team or Student Study Team, depending on how it's referred. Okay, now here's the interesting thing. A lot of kids in foster care are under an IEP. I shouldn't even say a lot. There's kids in the foster care system who have an IEP. They've had some type of a learning problem, they've had some type of educational concerns, and so as a result, they are monitored. And they are put under an individual education plan. However, what a lot of people don't realize is, and this includes not just foster kids, but this includes any kid, your own biological kids. Your own biological child starts to have problems in a school setting, you can request an SST meeting. It's literally, you write a little piece of paper that says, on behalf of my child, I, David McCoy, am requesting an SST meeting to look at and evaluate the needs of my child. But here's the interesting thing. Anybody can request an SST meeting, but you need to do it in writing, and you need to have 2 copies of the letter that you take up to the school. Because what ends up happening is that you're going to take up one letter and you're going to turn that in to the school. Hey, I'm requesting an SST. And by the way, here's a second copy. Can somebody sign this and let me out? This is my copy. Because technically a school has 30 days to establish a meeting when you've requested an SST meeting. The interesting thing is that school systems have a lot of resources that they can employ for children that are in need of educational services, if you're diligent in getting the services for your child. Question?
They're often secretive about it. There's been a lot of student laws that a lot of parents don't know.
And I'm not going to sit up and I'll be honest with you. I'm not going to bash the school system. What I will simply say is there's a lot of resources that the school systems can bring to bear for people who are advocates for that child. And this is where, if you begin to notice, even with younger kids, if you have a 2-year-old, a preschooler, a 3-year-old, and you begin to notice that there are certain problems that this child is having with regards to their learning, as a resource parent and as a social worker, I want to know about that. Because the earlier we can intervene, the better we can address the problem. The worst thing to do, and I'm going to be upfront with you, the worst thing to do is be a resource parent who knows, my gut tells me, you know what, there's a problem, but I don't say anything. Because it's easier not to say something. I want the resource parent who is proactive, not reactive. Question
About the IEP. I am a social worker. However, the IEP doesn't have to be, I know it can be requested by anyone. Does the educational right holder have to also sign it?
Yes, so for an SST to request the meeting, once it's determined that a child's needs are, they need an IEP, then they're going to look at who has educational rights to ensure that the plan that's established goes into effect. And so that's where, in some cases, we've had resource families who have been given court authorization to be the educational rights holder, because biological parents could be incarcerated or may be whereabouts unknown. And so as a result, that's where we then push for having an educational holder become you. So the challenge is being proactive to understand that, one, there's a need here. My child, there's something going on. And when I say my child, I'm talking about that child in foster care in your home, because I'm looking for you to raise that child just like you would your own. No different. Okay? There are pervasive developmental disorders. Those are distinguished by serious problems with an array of social and developmental delays and disabilities. Children tend to have severe impairments in social functioning and communication, as well as severely restricted behaviors, interests, and activities. Oftentimes there's neurological dysfunction is present in these types of disorders. And yes, this is a category of problems that we do see in kids that are in our care. Did you have a question? Okay. Next page. We start to look at ADD, or attention deficit and disruptive behavioral disorders. How many of us have heard ADD? How many of us have heard ADHD? Okay. How many of us have heard ADD but impulsive type? Okay. There's really different types of ADD. Okay? Not all ADD or not attention deficit disorder is just hyperactivity. There's impulsivity disorder. So the reality is that whereas this is something that's very common, and I will tell you up front that the chances are the longer you are in foster care, yes, you will have a child who has ADD or ADHD or some type of attention deficit disorder. Yes, very common. Okay, not just with foster care, with your own biological kids. We see it a lot. Question? Grandkids. As well as grandkids, by all means.
And our own selves.
And our own selves, exactly. Okay, but here's the interesting thing. The hardest thing to do is to admit that there's a problem. Now, as a resource parent, we are told we want you to raise this child just like you would your own. Understanding what? This is not your own child. At the same time, we also want you to be aware and be intuitive to the needs of that child. If you notice that a child is at school and they are having a lot of problems and their grades are suffering, and you're noticing at home that when you try to have that child sit down with you and do homework together, hint, hint, do homework together. Okay? And that child can't be there and you're finally just giving the child the answers yourself. Well, guess what? That child probably is going to, that ADD or that attention deficit is probably having an effect of that child at school as well. This is where we need to acknowledge, because yes, it is sometimes very easy to give that child the answer. You know what? Ooh, I've been here 30 minutes. I got laundry to do. I got to cook. You know what? The answer is just 5. All right? Yes, we get it. But that's where we also want you to tell us what you're observing, because that's a problem that isn't just confined to your home. That's going to affect that child throughout life. And unfortunately, the hardest thing to do is admit that we got to address the problem. Being a resource parent, and I want to challenge you right now, whatever your thinking may be, it is a challenge. Because 1, you're taking care of somebody else's child. 2, you're taking care of somebody else's child who may have problems that you didn't see in your own kids. And 3, you're tasked with, what are you going to do about it? Or what are you going to do with your support system to help this child? Because at the end of the day, it is about helping this child. Okay? A child can be, or ADD, attention deficit disorders, are distinguished by problems with attention and behavioral conduct, frequently diagnosed in school-age children. But yes, we do see it in preschool-age children. Okay? At the same time, ADHD is composed of 2 major symptom categories: inattention or hyperactivity impulsivity. A child may be diagnosed with either of these syndromes or with both of them. Children with ADHD begin to show symptoms of the disorder before the age of 7. And this is why you have to be in tune to what's going on with the child in your care. Okay? The one thing I do not like doing, and I got to be honest with you, as a social worker, kids in foster care get labeled. Okay? Oh, this child has this problem, this child has that problem. And I personally, I'm not real big into labeling a child, but what I am is my gut. I go with my gut a lot. Okay? If there's a problem going on, I'm not going to label what the problem is until I know what the problem is, but I'm going to say, hey, there's a problem and we need to fix it. And so, even though, yes, my name is David McCoy and I'm a social worker of the agency, and for those that have been in these classes, you'll also know that I'm one of the co-owners of the agency. I demand a lot out of you because I demand a lot out of myself. We are tasked with taking care of somebody else's child and helping them. And sorry to say, one thing that's understood about the kids that are coming to all of your homes, they have problems. Plain and simple. Because if something wasn't going on in their life that wasn't problematic, they wouldn't be in foster care. So your task is to understand right off the bat that this child, yes, when they come to my home, it may not be that they got behavioral problems, but they may be dealing with some emotional problems. Because no offense, think about it like this. You all have kids. You all love your kids. Say you love your kids, okay? The sad but honest truth is, as great as you may think your child is, take them out of your home. Put them in a stranger's home. Don't tell them when they're going to be able to go back home. Allow them to see their parent once a week for maybe up to 2 hours a week. And I guarantee your beautiful angel child that you love so much will change. Plain and simple. She said, not mine. Okay? They're going to have some problems. If it's not emotional, it's going to be behavioral. If it's not behavioral, it's going to be cognitive. There's going to be some type of changes by just being put in foster care. So I want you to understand that, yes, we are going to be talking about different problems that kids have, and somebody here will get a child that will have some problem that we go through, or a combination of problems. Okay? Turn to the next page, page 4, feeding and eating problems, or eating disorders. Distinguished by problems with the processing and eating of food, or retaining food, or eating inappropriate foods. It gives 3 different types of feeding and eating disorders. One of the things that ends up happening, and sometimes, I'll be honest with you, in infants, we sometimes see feeding or eating problems, right? Especially if there's medical issues or if there's children that were drug exposed, born with cocaine or speed in their system, they'll develop these types of problems, okay? And there are gonna be cases where a child may be placed in your home. And I'm gonna ask a question. How many of you guys are interested in having infants placed in your home? Okay? We see infants come into placement a lot. Okay, and for those that have been in earlier classes, I give you a copy of our our placement roster, and because we keep stats, and you'll see that the population that we get referred pretty much the most every month are infants. Now, having said that, what's one of the biggest problems that the infants that we see have? Drug exposure, going through withdrawals. And as a result, as their young bodies are developing, we will sometimes see some type of feeding or eating disorders. Now, right off the bat, anybody that's looking to take care of an infant, okay? One of the things that I would challenge you to say and remind you, because again, as we go through classes, you're gonna be reminded about what types of questions to ask and things like that. But if you know that you're interested in taking care of an infant, and you get that placement call, I don't care if it's 2 o'clock in the morning or 10 o'clock at night or 8 o'clock in the morning. If you are interested in an infant, ask what type of formula that child is already being fed. Because if you change that child's formula immediately on the spot, because you didn't ask what type of formula that child was taking, you were gonna have some reactions. And so it's important for a resource parent to understand that as you are getting that information, when we call you for a placement, we have tried to do our due diligence to ask some questions and get some information. But it's important for you to also ask questions and get information as well. Because at the end of the day, after that child is placed in your home and that social worker leaves your home, it is now you dealing with that child. And it's important for you to understand and know what type of formula that child was being fed. Because that may mean that you suddenly have to go out and purchase, before you can get that child under WIC, a particular formula for that child to use. In addition, find out if the formula that child was taking was in powdered form or liquid form. Because if a child has been used to always dealing with liquid and then suddenly you give them powder, that's going to cause some problems as well. That's why you have to ask questions. Questions do you guys have? Okay. Elimination disorders is another category of problems that we see in children, and those are distinguished by problems with bowel or bladder control. Encopresis is diagnosed in children 4 years of age or older. Enuresis is marked by repeated urination in bed or clothing. So how many of us have heard of the term wetting the bed? Okay. How many of us have heard of the term enuresis? How many of us, in hearing the term enuresis, know what that is? Same thing, okay? Wetting the bed is called enuresis. Having bowel movements is called encopresis. Now, here's the interesting thing. A lot of our kids, especially our younger kids, have problems with enuresis, okay? Now, how many of us, by show of hands, how many of us had fun potty training our kids? Okay, I'm glad you guys raised your hand. I didn't, all right? I hated it, all right? It was something I did as a father, but it was like, just go to the bathroom, Leilani, right? It's a challenge. Now, no offense, it can be fun, and you can make it fun, and you can learn to help a child go to the bathroom and be proud and play games, but it can also be frustrating. Realize and understand that children who have enuretic episodes may not always be upfront about their enuretic episodes. How you may find out about it is suddenly you walk into a room and you go, "Whoo, let me walk out of here for a minute." And you are going to be challenged with trying to find where the article of clothing that you know is soaked with pee is being held or maintained in that room and hidden from you, because that child is saying, "I didn't have an accident." And you know they did. Realize and understand. Whereas you may have had fun helping your child learn to potty train, that 13-year-old who has that problem and is embarrassed about it, or in some cases doesn't even care that they have that problem, and will look at you and deny having an accident, even though you see a wetness on their clothes and you smell it in the room. Realize and understand, you will be tasked with dealing with that. We've had a foster parent who's had older child, 14 years of age, who had enuretic episodes and just blatantly did not care and would lie about it. Sorry to say, that's not always fun. You had a question earlier.
I was just going to say, my son, he's 13 now, going to be 14, so, and he just stopped being in bed. And he goes maybe about a year ago, and the whole room would smell like pee. I hated it. But I just kept cleaning and getting the carpets clean and stuff.
Mm-hmm. And that is the thing. Realize and understand, you...
Yeah.
And it was just laziness, I think.
Different people have different reasons. I mean, and some kids, sorry to say, who are victims of sexual assault, sometimes display that as a means of, hey, if I urinate on myself, they stay away from me.
I just had a nice dream. I was going to the restroom.
By all means, there's different reasons, but that is the challenge, and this is why I'm saying, yes, we do see kids who have this problem. We will also have kids in placement, and this is the real challenge for you as a resource parent, is when you have a child who likes to smear their feces. Okay? Because yes, that will happen. Yes, I had an accident. No, I don't feel like cleaning it up. Yes, I want to wipe it all over your room. And yes, you're going to clean it up. And no, I'm not. And now all of a sudden, how do you deal with that? Because one, you want to do something you can't do. Secondly, you want to say something you can't say. And third, you have to also maintain your controlled emotional involvement in working with that kid to address that problem. Because these are the problems that kids in foster care will sometimes have as well. What's that?
I said, I've seen it in adults that smear feces over everything.
Yep. So that's where we have to realize and understand. Some of our kids do have problems. And our task is to not personalize what they do, but to help them learn not to do it. And that can be a challenge. We don't see a lot of kids who have tic disorders. However, if you turn to the next page, I do want to talk about separation anxiety disorder. Okay? That is something we do see a lot with a lot of our kids. Okay? The underlying how we set up the classes is the orientation, class 1, class 2, and class 3 lay the foundation of foster care. Okay? In those 4 classes, you learn about the whole CPS system, you learn about what being a resource parent is about, you learn about understanding the trauma and victimization that kids in foster care undergo. So the orientation, class 1, 2, and 3 lays that foundation. Classes 4 through 7 begin to look at particular types of problems that kids in foster care have. So that's where we start to look at some of the mental health related issues or some of the childhood and infant disorders that children have, or we begin to look at, for example, CSEC populations or medication management and things like that, right? But What's the underlying issue that a lot of kids in foster care have? Trauma. Dealing with trauma. And think about it like this. Has anybody here lost a loved one? Mother, father, sibling? Is that something you get over with just right instantly? It happens and you just get over it. Okay? As an adult, if you lost a loved one and somebody told you, shake it off and get over it, would you have sympathy towards that person, or would you think about wanting to punch them out? Okay? You probably want to punch them out and say a few things, right? But here's your challenge. Now you've got a child placed in your home who's been put in your home via foster care. They got removed from their home because of whatever was going on. It may have been drug use in the home. It may have been they were victimized physically, sexually, emotionally. It may be that they were just a sibling of an abused child. But for whatever happened, they were removed and put into your home. And who do you represent to that child? A stranger. You represent a stranger. When that child is first placed in your home, they don't know you. You have to develop and work to understand and develop their trust and develop a relationship with them. But then suddenly the child starts to have certain problems. They start to tantrum. They start to act out. They start to have enuresis or enuretic episodes. They start to scream and holler. They start to act out in school. And suddenly, we lose sight of why they were put into our home in the first place. Something serious and unfortunate happened to them, which resulted in them being put in a stranger's home called a resource parent or a foster parent. And we suddenly stop losing, or we lose that sympathy and turn around and expect that child to get on our program and do what we need them to do. Is that realistic? If that is you, or that develops into you, you just became the person that told you to get over your significant other's death. Is that fair to that child? Not at all. Don't become the person who's insensitive to the needs of that child as to why they were put in your home in the first place. They were put into your home because they experienced some type of trauma and some type of problem. And you are tasked with having the opportunity to uplift that child and show them that regardless of everything that happened, you are that one person who can show them what they can still become. That's your task. Don't be the person that becomes unsympathetic and totally expects that child to follow your program, because that makes it easy for you. Does that make sense? So having said that, when kids are placed in your home, is it natural that a child will think of their parents? Is it natural that a child will scream and holler and cry and yell when they're having a visit and that visit is about to end? Is it normal for a child to wish to go home, even if their home environment wasn't what we identify as the best environment for that child? That's recognizing and understanding what separation from their parents and their family means to that child. Because unfortunately, the sad but honest truth is, all of the craziness that went on in a child's home, for that child was still normal. Because even if there was craziness when dad got home at night at school, that's where they got to be with some people that they called friends. Even though mom may not have been home a lot because mom was out doing whatever she did on the street, hustling to get money and selling herself, there was still a sense of community and family in that environment. And so whereas we look at it and say, well, why would a kid want to go back to that? For that kid, life was not always bad. That's what that child understood by being in their environment, because they knew and they understood what would be normal and abnormal at given times. And even though the bad things that may have happened, that child does not want to happen, they want to feel safe, they still are going to miss those good times that they had in their environment. So realize and understand, when a child is placed in your home, even though you're going to be told the things that are going on with the child, because when we call you for a placement, we tell you they were a victim of this, we talk about the WIC codes, we talk about the reasons for entering foster care, we even sometimes ask you what are some questions that you may have, and we are able to find out additional information. But at the end of the day, sorry to say, that chaos that you will hear to that child is still in part normal, because that was their home environment. And no offense, what goes on in my home, some of you may look at and say, that's crazy. What goes on in your home, I may look at and go, that's crazy. That's what I need you to understand in the kids that you deal with. The hardest thing about being a resource parent is being able to look at things from the perspective of that child's understanding versus looking at things from your own understanding. Because what you want to do is bring a better sense of life to that child. What you should be looking at is how can you help that child see a better sense of life in themselves. That's your challenge. Does everybody understand? So, what do I want you to get out of this little bit of a discussion? 1, kids have problems. 2, the extent that a child has is going to be dependent upon what they have experienced. 3, it is not up to you to judge what that child's home life is like. What is important for you to do is to help that child see their own potential and how they can grow and become better. 4, the only way you're going to do all of those things is to establish a relationship and a communication with the child in your care. And that does not mean, come on, boy, we got to go do this, 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 and this. It's an open give and take. Successful resource parents learn to integrate the child and what the child wants to do into their household, not dictate to the child, this is what you have to do. Because yes, sorry to say, as a social worker, I'm going to look at the needs of a child. I'm going to look at setting up services, counseling, and all these things. But I'm also going to want to know that that child is doing something other than just staying at home, reading books. Are they going out? Are they having fun? Are they involved in social and recreational activities? What type of involvement are you doing with them? Do you encourage them to play sports? Are you there being the biggest cheerleader for that child? Because everybody loves a cheerleader. Okay? Every kid does. Yeah, we hear our kids turn around and our kids will say, you don't have to come, Mom. You don't have to come, Dad. You're embarrassing me. Trust me, they love it when you're embarrassing them. Maybe not at that time, but they do love it when you are there embarrassing them, because, sorry to say, what they then know is that you care. And that's the most important thing that you can do for these kids, is regardless of the problems that they have, to show that child that you care about their needs, and that you care enough about their needs to own up and acknowledge what their needs are, and ask that child how you can help them address those challenges. Successful resource parents or successful foster parents learn to communicate with the child, not just to say and look at a child and say, you got problems, so let me tell you what you need to do to fix your problems. They look at a child and say, hey, what's going on? Is that a problem for you? How do we help you deal with whatever you see as a problem? And by the way, this is kind of what I see. Is that a problem for you? Or how can we make that less of an issue? Does everybody understand? So having said that, any questions on anything I've said up until now? So here's what's going to happen. I'm going to divide you guys up into a couple of groups real quick. You three are going to be one group. You three are going to be another group. You three are going to be a third group. You can be with your mom, okay? Now, in your groups, since you guys are already kind of positioned, except for James, you're going to have to kind of come closer. I'm going to present a scenario of a child to you. And what you are going to do in your group is you are going to have one person who has to write down what I'm telling you. And then everybody else in the group, as well as the person writing it down, will look at what you can do to help the child deal with their problem. Okay? So, here is your scenario. You have a 16-year-old girl, okay? 16 years of age. Specifically, she was Asian from, let's say, Vietnam. No, Asian, specifically Chinese. Placed in foster care. At the time of being placed in foster care, this particular child, who let's say is a boy, did I say? I'm sorry, boy. Yeah, I'm sorry. Back up, boy. 16-year-old, right? Boy. Boy. He's going to be a boy. Okay, sorry. 16-year-old boy, placed in foster care, speaks limited English. Speaks limited English. Okay? Placed because of physical abuse. That child is placed in your home, and everybody in here, no one's Asian. So how do you help that child adjust? That child has social problems, will not look eye to eye, does not maintain eye contact, has social problems in that that child also is not age appropriate. All of his current grades are Fs. 16-year-old typically should be in the 11th grade, correct? 10th, 11th, okay, 10th. He's in 8th grade. That's his academic level, okay? They physically have him in the 10th grade, but academically, he's in 8th grade. So here's your task. How do you help this child? And what can you do to help that child's adjustment to your home be okay? Take about 5 minutes. Okay. So then let's do this. Let's look at identifying before we get into how we're going to address things, let's look at this child's needs. What kind of needs or assistance does this child need? Okay? Name one, just identify. Okay? Okay, what are some other needs that the child has? Okay, so there's definitely going to be some therapeutic / medical type needs. Okay, those are going to be more emotional, therapeutic needs. What other needs does this child have? Social. There's going to be some social needs, right? Because ultimately, that's a whole different, for lack of a better word, he's in a different environment. He's come from a different culture, so there's cultural needs, there's social needs, there's medical needs, there's therapeutic needs. What else? There's academic needs, educational needs. Okay? It's fair enough to acknowledge the different needs that a child has. So one of the things in listening to everything, I wrote down there's a cultural needs, there's academic needs, there's therapeutic needs / medical, as well as there's social and emotional needs. Okay? Fair enough. It's important for a resource parent to begin to look, when you're trying to help a child, rather than immediately just say, let's get this, let's get this, let's get this, start compartmentalizing things. Okay? To have a plan rather than to just run roughshod is important. So we've identified different needs that the child has. So let's look at cultural needs first. Okay? How do we help him address his cultural needs?
Engage in a church. I would ask him his religion.
Okay?
That also could have something to do with his eye-to-eye contact because,
Okay? So potentially to find out the religious background, if he goes to church, if he is supportive of that, does he continue to want to? What else?
Food.
Identify from a cultural perspective. Hey, what kind of foods do you like? What are some of the things that in your own culture that I can maybe help you with? Okay, to make it feel more like home. Okay, how else do we help him culturally?
Take him around his culture, things that he's used to doing in his culture, like try to get him in some of those activities or bring him around that so he just won't be stripped away from it.
So at age 16, that means we need to communicate to find out what were some of the things that this child liked to do. What were some of the things that make this child feel happy, remind him of good things that may have occurred in his life, and then begin to incorporate those things into what we do for this child. Okay? Anything else?
Routines. Sometimes they do have routines, especially Chinese.
Okay?
They have a culture thing where they never come in the house with their shoes.
So assessing what are the cultural norms that this child has participated with in their own family. Okay? Do you eat with chopsticks? Do you know how to eat with spoons and forks? Are you more comfortable eating with chopsticks? Are you willing to learn how to eat with forks and spoons? Those are things that are important because that's how you're going to help this child. Okay? Therapeutic needs and or medical needs. Specifically, one question right off the bat, and this is to my people who've attended these classes before. Quiz time. What WIC code is this child is adjudicated under? Okay, this is something new for new people. Okay, it ain't new to you. What WIC code? We know that this child was physically abused. All children in foster care are adjudicated as a dependent of the court under the Welfare and Institutions Code, Section 300, subsection A through J. Which code? Which letter?
B.
You're taking a guess. All right. Physical abuse. A. Okay. WIC 300A child. Don't forget your WIC codes. For those that are new, this is something you'll learn in a different class. Okay. You need to always remember what codes a child is adjudicated under because the codes help you to learn things about the child. So, therapeutic and or medical needs. This child was a victim of physical abuse. How are we going to help this child deal with that trauma associated with the victimization of being physically abused? What are we going to do for that child?
Privacy.
What's that?
Privacy.
Okay, we're going to definitely want to incorporate or make sure that the child has privacy in their life. What else though? Okay, we're going to want to get this child involved in therapy. Okay? We are definitely going to want to see that this child gets involved in therapy because one of the ways that you learn to get past the victimization is to be able to talk about the victimization. Okay, so getting this child enrolled in counseling is critical. What else?
The boundaries of the child. They may not want you walking up on them.
by all means. Depending on how this child is, you aren't going to want to be all up in this child's space, okay? You're going to want to establish boundaries. You're going to want to make sure that this child understands and recognizes that they're in a safe space where their space will not be violated in your home. So you need to assure this child that, hey, understand and realize we're going to give you time to get adjusted, but at the same time, understand that when you're in this home, I'm not going to violate your space. Okay? Earlier, I heard somebody talk about a medical exam. Isn't it important to get this child seen by a doctor? Okay? Because we want to know if there's not only physical injuries that we can see, but we want to know if there's physical injuries that maybe we can't see. One thing about physical abuse, physical injuries will heal with appropriate time and intervention and treatment. It's the emotional damage that we're left with, okay? So we want to get this child seen by a medical doctor. We definitely want to get this child seen in counseling and continue with treatment. You're going to have a social worker assigned to your home, such as myself, such as Maria, or one of my other employees, and we are all, our background is to also provide counseling. But we're going to want to also provide a therapist who's going to be working more longer term counseling to deal with and address the victimization that this child has and the trauma that this child has. Is there anything else we can do with the medical or therapeutic needs of the child? What would you say?
Myself?
No.
Just get,
Not you. You can't talk. All right? What would you say? Don't go with her writing. Tell me what you would do to help the child. Forget the writing.
To help the child?
Yep. So you know that you have a child who's been he was physically abused, 16 years of age. He doesn't really maintain eye contact. As a result, you're trying to help this child either therapeutically or medically. How do you help that child?
Well, first of all, I would call and get a medical examination of the child.
Okay.
And
Right.
where we can learn to talk and trust each other.
Okay.
In confidentiality.
So here's the challenge. I may be trained in counseling. Okay? A therapist may be trained in counseling. Who do you think makes the most change in the lives of these kids? Me or you? You. Our whole treatment philosophy at a coming of age is that the foster parents or the resource families are the main agents of change. That is our whole therapeutic process. Why? Because the child is with you 24/7 for the most part. So what do I want of you? To help this child therapeutically, to help this child medically, I want you and that child to start bonding. How do you bond? Spending a lot of time, being honest, communicating openly with each other. How you're truly going to help this child is to talk with this child. Find out what their needs are. Find out what their strengths, their weaknesses are. Establish a rapport, a bond, communicate with the child. That's how you're going to make a long-term difference in the child. Because I'm only in your home basically for about an hour, once a week. And whereas I might be able to do a lot of wonders, the truth of the matter is you're the one who really creates the magic with the kids in your care. So my expectation is you're going to start doing things with this child. You're going to make sure that every child in your home has some time, be it a few hours of a week or what have you, one day a week for a couple of hours. Every child in your home has your individual personal time. Because that's how you establish trust and a relationship with this child. Does everybody understand that? Academically, how are we going to help this child academically? Okay, request an IEP or an SST. What else? Okay, tutoring. A resource parent always has resources that they are ready to employ before waiting for a referral. So you're going to already know tutoring services in your community that you can get this child help with. You're going to be an advocate at school who's requesting that they provide the necessary services for this child. What else? How else can you help the child educationally?
A translator possibly at the school, I don't know how that works.
Okay, possible. You'll see if the school can offer that. More importantly, you'll help that child learn their academics, doing homework together, showing that child that homework's important, and more importantly, you're willing to help them understand it by working with them together. A child learns not by going to a tutor. They learn by having a stable family who truly is working with them to make sure that their homework is done. When I grew up, it was me, my twin brother, and my mom. The one thing I learned early on, one thing I heard very much from my mother, you're going to college. Growing up, I didn't know anything about high school. I just knew I'm going to college because that's what my mom instilled in me. As a parent, you are going to be that child's tutor. Yeah, we can get them outside help, but the person who's going to be doing the tutoring most of the time with that child is who? You. Does everybody understand? This is how we help these kids. We have to take our job serious. Because what are we doing? We're changing the life of a child, one child at a time. Any questions? So let's do this. I want to break for about 15 minutes. Okay, so we're going to go ahead and get started. And what we're going to do for the remainder of our time is we're going to actually talk about the commercial sexual exploitation of children. That's specifically referred to as CSEC. And when we start to talk about the commercial sexual exploitation of children, what that basically means is that it's sexual activity involving a child in exchange for something of value or promise thereof to the child or another person or persons. In a nutshell, the child is treated as a commercial object and sexual object. One of the things that when we start talking about CSEC youth, one of the things that I like to do is I like to start off by showing a little bit of a video presentation. And so what I'm going to do is I'm going to have you guys watch this. It's about 6 minutes in length. Once that's done, then we're going to talk about this population or subpopulation of youth. Because this is a growing population of youth that a coming of age has dealt with a lot, and that we are only seeing our numbers increase in the youth that we're dealing with. The unfortunate thing is when we talk about CSEC youth, we're not talking just about 16, 17, 18-year-olds. We're talking about youth as young as 12 to 14, because that's the jumping in period where typically kids are acclimated into that history. So I want to start with this, and then we'll watch this, and then we'll talk for a little bit afterwards.
The history of slavery in our world isn't over. Prostitution, the world's oldest profession, is actually a horrific trade of human flesh. Over 80% of victims are women, and most of them are children. Most people only think that this is happening in Asia, in countries like India, Thailand, Vietnam, and Cambodia. But in reality, hundreds of thousands of these children are at risk every single day for being trafficked into sex slavery here in the US as well. As girls living in the Bay Area, where 40% of all of America's sex trafficking takes place, we wanted to find out where the fastest growing criminal industry in the world all starts, here in our backyard.
On the average, some of these exploiters have as many as 10 girls that they are exploiting. And it doesn't take very much for an exploiter to lure a child into his business by just saying a few nice things to them.
There's this whole underground world that OPD basically discovered in 1999 of young girls being sold for sex in our own backyards. Really, when you look at how it's happening and the deprivation of liberty that takes place in order to accomplish the crime, it is modern day slavery.
These children are beat, they take their clothes away, they take all their property, their phone, their identification. They'll move them to places where the child doesn't know where she is. These kids are sexually assaulted by the exploiters. They are raped and sodomized. Children being chained to the heater vents. At the end of the workday, the kids' clothes are taken away from them and they're left naked in rooms so they can't escape.
She needed money and she doesn't know any other way to get it. She thinks about it, especially when times get tough at home, because home is not a place where she likes being. A woman's body is kind of what you barter on and is what we trade on, and that is kind of cultured into, you know, part of our mentality.
What ends up happening is once you strip all the makeup and you strip off the nails and you get back the layers, they're just a kid. People always ask us, you know, how does a 12-year-old or a 13-year-old girl go from sitting in an 8th grade classroom to, you know, selling her body to 20 men per night? Most oftentimes the exploitation on the street is not the first act of rape that they've ever had. And so when you come from such neglect and you come from such risk, and your uncle or a trusted family member has been molesting you since you're 5 years old, and you really believe that your body is a sexual object and not what it's there for, when a 30-year-old man pimp comes along and tells you that, you know, he loves you and you're the most beautiful thing that he's ever seen, it's really easy for a grown man to talk a 12 or 13-year-old girl who's been through the things that she's been through into doing that.
Pimps, exploiters of human beings, take advantage of these girls and their histories of abuse to use them as economic pawns. Over 70% of all girls being trafficked for sex have escaped abusive home lives as runaways, and almost all of them have been sexually abused and raped before adolescence. They take girls who have never known love and trick them into selling their bodies. Girls are also abducted off the streets by pimps.
They don't have any empathy for another human being. That exploiter will get tired of the child, so he'll sell her to another pimp or exploiter. Her psychology, ability to even evaluate what's safe and what's not, is completely diminished.
She does not understand her victimization, and the only thing that we can really compare it to is Stockholm Syndrome or battered wife syndrome. The fear and the guilt and the shame and the physical and emotional pain that comes along with having to be exploited every day, you know, by grown adult males, and for no gain for them whatsoever. She stands there every day and takes all the risk of being killed, the risk of being infected with AIDS, the risk of going to jail. She takes all the risk and has absolutely no power over her life or her decision.
We actually try to engage them and encourage them to get involved so we can find out who the pimps are, who are pandering them, who's forcing them into child exploitation, and try to find the reason why they're not in their homes and what their parents are doing. You know, when I first started over 20 years ago, you would see in the 20s and 30s. What I see now, as young as 13 years old, 7 days a week.
Human slavery isn't over today. Women and girls everywhere are suffering. They end up under the control of a pimp who promises to take care of them. Soon, however, the master and slave relationship is established and maintained through even more abuse and violence. And at that point, they are completely at the mercy of these men. The exploiters doing this need to be stopped. Help us bring an end to the abuse, to the pain, and to change society so that it is no longer all right to buy sex from a child. It all starts now.
So when you guys hear that, you ask the question of, is that a form of human trafficking? And that's exactly what we're dealing with. Children who are commercially sexually exploited are in many cases trafficked. And so the challenge of a resource parent in dealing with a youth that's been trafficked starts with establishing trust. Because think about it, who are these girls trusting? Okay? The person who is taking advantage of them by force. And so your challenge and your task is then to help them understand their self-value and their self-worth. So in your packet, I'm going to go through some things or some information with you. And then what we're going to do is I want to kind of challenge your thought processes with regards to children who have been commercially sexually exploited. Okay? When you are working with a youth, your initial focus, a youth who's been commercially sexually exploited, your initial focus has to be on meeting their basic needs. Okay? At the same time, acclimating that youth to your home. We are not worried about treatment first. What we are worried about is stabilization and stabilizing them in your home. Because sad to say, a youth who's been commercially sexually exploited is used to being moved around. And in many cases, when they are placed into foster care, they will do whatever they can to still try to leave, to go back to that pimp. And so as a result, the challenge is not to immediately get them involved in treatment services. It's about stability and about establishing trust. Does that make sense? Yes, we are going to want to connect them with outside resources, and that will come. However, your first task is how are we going to keep them in our home one more day? That's your first task. What is it going to take for that youth to stay in your home one more day? Because the longer and the more that they stay in your home, the trust, the relationship, the bonding can then happen so that the services can be put into play. But the key for you is to understand and recognize that they are at a high risk of leaving. And so your task is, how do I keep them here one more day? That's why you have to spend time getting to know that child and getting that child to know you and to feel that you are going to listen and, more importantly, not judge. Because the challenge for that youth is to understand that there are not everybody is judging them. And that's hard. Because that is not something you can do by just talking. You have to show it, and that child has to feel it. Statistics reveal that 60% of children estimated to be at risk of commercial sexual exploitation fall within the runaway or throwaway categories. There are certain red flags, and I've given you a lot of information on CSEC youth. We are not going to go through it all. I'm going to point out some things that I want you to be aware of, but realize and understand one of the populations or one of the red flags that we deal with are kids that want to run away frequently and constantly. And that puts them at greater risk of being exploited by someone. Which is why, as a resource parent, it is critical for you to understand that when a child is displaying certain activities or behaviors, they are constantly on their cell phone, texting someone, they have multiple cell phones, they are constantly meeting up or developing relationships with older people. These are red flags that you need to be aware of, that you also need to make me aware of. And then you need to also keep visual eyes on a child. How many of us right now, by show of hands, are interested in working with teenagers? Okay? 2 people raised their hand. So here's my question to everybody else who didn't raise their hand. What's your fear about working with teenagers? Honestly.
I don't have a fear about it.
Or concern?
them up in any way. Once they move out, we can focus on maybe teenagers. Yes.
Okay, she jumped on that in a heartbeat. Yes, that's right, yes. Okay, all right, I'll come back and I'll challenge all of that, all right? But what else? Are some of our worries that they're gonna talk back and they're gonna misbehave? Honestly. Okay, that's a typical teenager. That is a typical teenager. But it's a typical teenager in somebody else's child, not my own. Okay? Not necessarily, absolutely. Okay, but one of the things that I hear a lot is, I don't want somebody who's going to be jumping out windows. I don't want somebody who's going to put my own kids at risk. This is the challenge. This is the challenge. Because what age did they talk about in here that they're seeing kids be put out on the street prostituting? 12, 13, 14 years of age. Well, no offense. I see that you have 2 children. I heard you said that your son is 8. I'm assuming your daughter's somewhere around 16. And I heard you say you have another son who's 12. Okay? One of the things that I just want to kind of point out, no offense, I find that with teenagers, if you have the right mentality, if you don't prejudge, you can get a teenager to talk and understand and have an ongoing communication with a lot easier than an 8, 9, 10, 11, 12-year-old who wants to do what they want to do their way. And to be very honest with you, what I personally find, and I'm not implying anything, but what I personally find and what I personally see is that those that have more of a concern about teenagers oftentimes have the hardest problem dealing with the 8 through 12-year-olds. I'm just being honest with you. Because teenagers, if you have the right mentality, if you come at it with an understanding of this is about developing an understanding and a rapport, teenagers will actually listen when they know that you're committed to them to help them. Whereas, no offense, I see it within our agency a lot. 7, 8, 9, 10, 11, 12-year-olds, it's all about me. What I want, what I expect. I'm not listening to nobody, and I'm going to be the most hard-headed kid, period. So I'm just pointing that out. Don't turn around and assume that just because you're dealing with a teenager that they're going to influence your kids negatively. Because sometimes, and I'm just being honest with you, sometimes the teenagers, by undergoing their own personal experiences, can help you deal with the younger kids. Because they can tell you through their experiences, hey, you need to listen to your mom. I'm just throwing that out there. Oftentimes, the sad but honest truth is, and I'm going to just be upfront with you, one of the things whenever I do a class and I say how many people by show of hands are interested in working with 0 through 12 or 0 through 10, I get a lot of hands that go up. When I say how many people are willing to work with 15 through 20, I get 1 or 2. You start with whatever you're comfortable with. But what I will tell you up front, and I'm going to just be up front, because my job is to be very straight with you. If you know in your own home, you were dealing with challenges with your own biological children, and your own biological children happen to be younger, when you bring in a child who's in foster care around the same age as that your own child who's having problems, your life will not be easier. Because that foster child will see how your own kids take advantage of you. And guess what? They're going to learn those exact same things. So I'm just throwing this out there that you have to understand and recognize, yes, we always are worried about somebody influencing our kids. The question really is, what influences are your kids having on foster kids? Because a child in placement comes in, and what's the first thing they're doing? Studying your whole family dynamics. They watch who you give into, who you get mad at, why you get mad, what you allow to happen that they can manipulate on. They watch your whole family dynamics. And then they do those exact same things. So don't assume that just because we deal with kids who come from histories of physical abuse or sexual abuse or what have you, that it's the older kids that are going to somehow bring problems to your home. Sorry to say. Sometimes the problems start with your home, and it's influenced by the kids watching the dynamics in your home. That is why I will challenge you to say, don't make the assumption that somebody's going to influence your kids. I always look first and foremost as what influence are your kids going to have on this child in foster care? True or not true, Maria?
What was that?
True or not true?
I'm agreeing.
Okay? No offense. As a social worker, when I come to your homes and there's bio kids there, I'm watching your bio kids and how you react to them.
But it does go with the mentality of the foster parent and how they react to that teen.
Most certainly.
And their thoughts and their ideals. And yeah.
Realize and understand that homeless youth, especially unaccompanied homeless youth, fall squarely within the high risk profile of being trafficked. Human trafficking is a form of modern day slavery where people profit from the control and exploitation of others. And your challenge as a resource parent in working with a child who is being trafficked is to look at how we ensure safety and stability within that child. It's important to understand that kids that are trafficked, and I'm going to kind of go off on a little bit of a tangent and talk from more personal feelings. Kids who are trafficked, at the root of everything, what is that child still? They're still what? A child. No offense. What does that child ultimately need? Love, caring, compassion, what else? Safety, understanding. Someone who is willing to listen to them. A child who's been trafficked, all of those things started off oftentimes in their home environment where something wasn't there, okay? Somehow, some way, they didn't feel loved, they didn't have somebody that was listening to them or what have you. And I'm talking about for our minors, okay? And so, unfortunately, for that child who's been trafficked, they were missing those stable foundations. This is where you come in, because now a child's been placed in your home. And the child's had all of those experiences. When they first come into your home, are they going to trust you? So whose job is it to get that child to trust? Is it the child's job to trust you, or is it your job to get the child to trust the child? You have to work harder, okay? If you don't start off understanding that, you are already not going to succeed. If you are automatically assuming that, oh, they are going to fall back into this, you are not going to succeed. If you're making the assumption that my home is the best home and they would never want to leave me, you're not going to succeed. You have to take a very realistic and understanding approach when you deal with a child who's been trafficked. That one, their initial foundations of trust were not met. And so what you have to go with the approach of is to help that child recognize and understand that it starts fresh. They have to learn to trust someone. So that means you have to work harder to establish that child's trust than that child will trust, so that that child will trust you. At the same time, do not assume things about the child. One of the biggest problems that we see with resource parents that work with CSEC youth is that the resource parent assumes too much. In other words, you bias yourself. You start to hold certain assumptions and associations about the child. Well, no offense. I do training classes, and we all pick up on vibes, right? I can tell who's listening, who's falling asleep. I can tell these different things. It's already getting to the point where I can start to tell people are fading out, okay? Well, guess what? A child who has been taken advantage of by others is very much able to pick up when someone truly cares or is faking it like they care about that child. Your task is to get that child to know in here that you truly do care about them and that you will accept their mistakes and their mess ups and won't judge them. Because the likelihood of running back to the streets initially is there. And if that happens, and then that child comes back into care, and you are still there for that child without judging that child because you understood that the likelihood of them going back to the streets was likely to happen, but I still care about you, now you're establishing trust. This is what you have to understand. Relationships take time to develop. If there's one bit of information I can leave you with, don't establish artificial time frames. In a month, they'll be fine. In a month, they ain't trusting you. This is a population it takes work on. But more importantly, it starts with you knowing you. Because if you have biases, that child who has spent their time on that street dealing with people who've taken advantage of them, and their survival skill is to learn the likelihood of them being taken advantage of, they can pick up on those biases that you have. Because that's how they survive. They are better at understanding you than you are. So recognize and realize it's important for you to educate yourself. It's important for you to understand. It's important for you to sympathize, but most importantly, realize and understand that every child in foster care is at an increased risk of being exploited. And the majority of kids who have been exploited, it didn't start by them just walking out on the street. It started with them being exploited in their home by someone they knew before they hooked up with someone they didn't know. How we break that cycle is to get that child to understand that you are somebody who cares about them, truly cares about them, and will not give up on them. Any questions? Okay. Thank you guys for coming to class number 4. I appreciate it. Hopefully I didn't scare off too many people. Hopefully I'll see you guys tomorrow for class number 5. And other than that, take care, have a good day.